Congressman Higgins, nice to see you this morning. Appreciate you making the time.
I'm glad to be with you.
So you have been extremely vocal in trying to get some clarification around how the U.S.-Canada border will reopen, what sort of metrics you want to see. What do you think the plan should be going forward?
Well, I think we should have a plan, and it should be a binational plan that's developed by the Canadian federal government and the U.S. federal government toward the goal of, at the very least, expanding that category of essential traveler to include people that have properties in Canada, that live in the United States, loved ones that have been separated, and business transaction. What we have now in the last couple of months that we didn't have for most of this pandemic is a very powerful medicine, a vaccine against COVID. Sure. And our Centers for Disease Control and Prevention has made very clear that you pose, if you are fully vaccinated, a very low risk of getting COVID or giving COVID, even when taking into consideration all of the variants.
Right. So you're not even saying open the border to everyone. You're saying let's open it a little bit wider to some people.
I'm saying just gives people a sense as to what you're doing on a binational level basis to open the border, both incrementally and fully. The President of the United States, Joe Biden, had said several times over the past 6 weeks that he is hoping that the United States will be back to a semblance of normalcy by July 4th. For us, along the U.S.-Canadian border, a sense of normalcy, a semblance of normalcy, is getting the border open. But if you have 4% of your population that is fully vaccinated, they pose very little risk. And that 4%, should be able to travel to the United States. We have about 38% of our population. They should be able to travel to Canada.
So okay. I think you've written to the president or you've spoken to the president about this and tried to get him to engage with our prime minister about it. Do you have any sense of whether that's happened or whether that's going to happen?
Well, on the second day of his administration, President Biden issued an executive order directing his cabinet secretaries to develop an opening plan for the border within 14 days. Now, that wasn't to open the border within 14 days, but to have a plan. That was many, many weeks ago, and we don't have a plan. On the Canadian side, the Prime Minister Justin Trudeau, announces on a monthly basis that the border is still closed without any context, without any acknowledgement that both on the Canadian side and the U.S. side, during the entirety of this pandemic, we have been told by our respective public health officials and our elected officials that the game-changing moment, the inflection point in all of this would be the availability of vaccines. Now we have vaccines, very powerful medicine against COVID, and that should change things. And the United States, I've urged the Biden administration to do everything they can through the World Health Organization and other organizations to get vaccines to Canadians. I want to open up the United States, New York State, Western New York, to Canadians to come over here for the purpose of being vaccinated. So we're trying.
So let me end on that point, because the public health officials were asked about that this week, and their thoughts are, first of all, we have a lot of vaccine coming into Canada now, so it is available, and the second point is that why take a risk, because it would be a risk to travel to another country and to potentially expose yourself in order to be inoculated, given that it takes then 2 weeks for the vaccine to take effect. Do you really think that Canadians crossing the border to get vaccine from the United States makes a lot of sense here, or would it not just be better perhaps for you to ship the vaccine to us if you've got extra?
Well, look, I think there are 3 other states in New York, including, or in the United States, including North Dakota, that are doing that and doing it successfully. Keep in mind, 4,000 truck drivers pass into the United States and Canada every single day on the Peace Bridge. 700 essential travelers have been traveling without vaccinations for the past 14 months without incident. So, what is one of the essential travelers or exception? It's for medicinal purposes. If a Canadian is receiving cancer treatment in the United States, they can come over to the United States. If you need a vaccine during a time of a public health crisis, a pandemic, what better municipal exception or medicinal exception is there than to get vaccinated? So if you are smart about it, if you wear a face mask, if you practice good social distancing, you would pose very little risk coming to the United States to get vaccinated and then going back. Look, I would prefer that we give Canadians in Canada vaccines, but for whatever reason, they're suggesting that that's not logistically possible, and therefore Canadians would have to travel to the United States. But it's not as though they're not traveling anyhow for medicinal purposes.
Okay, Congressman, hopefully we'll get some clarity in all of this in the weeks ahead, and we'll have you back. Thank you very much, sir. I appreciate your time.
Thanks for having me. Bye-bye.